how robots are changing the face of medicine. I'm Steve Price. We'll introduce you to Iris coming up in a live report on News 8.
The pictures, the stories, your world. This is News 8 at 5.
A health alert tonight. Doctors at a North County hospital are getting some high-tech help making the rounds.
Dr. Robot lets them check on patients from just about anywhere through the use of a laptop and a joystick. News 8 Steve Price is live in Poway with more on how this robo-doc works. Steve?
Well, Carlo and Marcella, she never went to medical school, but one day she could help save your life. Tonight we introduce you to Iris.
Any sore throat at all from the tube coming out?
Just slight.
Dr. Ben Cantor can't always be at Pomerado Hospital in person, but with help from Iris, he's never far away.
The head moves independently. I can look around.
She's named Iris because she gives doctors a second set of eyes. The robot's cameras can zoom into important details.
Using the cameras on top, I can see the patient, I can see family members, I can visualize what's going on the monitors, I can evaluate ventilators in the intensive care unit, and at the same time, everybody can see me.
Patients see the doctor on a monitor that acts as Iris's head. Microphones and speakers allow for two-way conversations. Doctors say it's much better than simply talking to a nurse on the phone, which has been standard procedure until now.
I can look at the patient, I can do a further interview of the patient, I can ask the nurse to do certain physical things if it's minor, and I can do my assessment and at that point determine, boy, this is something I need to get to the bedside ASAP, or something else is going on and I can handle it remotely.
Without question, Iris's biggest benefit is her ability to get a specialist into a patient's room immediately, even if that specialist is really miles away.
I could be at home, I could be out of state, I could be out of the country, as long as I have this particular control station.
It's too cool, I like it.
Phyllis Rodriguez is in the intensive care unit at Pomerado Hospital. She met Iris for the first time today, and so far, she likes her.
I think they probably can monitor you a little bit closer with this.
Iris works with wireless technology, but doctors say everything is encrypted, so patient information cannot be hacked. Iris is one of about 200 robots in use at hospitals around the country, and the first in San Diego. Now, the doctor who operates Iris can also take his face off the monitor and put up x-rays or other important information, and then, like you see in football games, can actually circle different things on the monitor so the patient and the nurse can see exactly what the doctor is talking about. It's really cutting-edge technology, and Carlo and Marcella, they're talking about a newer version of the robot where several different specialists can all be watching from different places at once to analyze something going on with a patient. This is just the tip of the iceberg, what we're seeing here with Iris.
That's cool stuff. Marcella had to spend 8 weeks in the hospital. I'm just wondering, how would you have liked RoboDoc at the bedside?
I had to wait a long time sometimes for doctors, so that would have been great, although I probably would have been a little scared, Steve, if you'd popped up in the screen right there.
Oh, I can see it as a RoboDoc.
You look good as a doctor. Very nice, Steve.
Unbelievable. Thanks, Steve.
I did not operate on any patients while I was here. I'm just making that clear.
Okay.
Thanks,
Good to know.
Steve.